Good evening. My name is Chezo Nojang, a student at Kapping State University in the Family Nurse Practitioner Program. I'll be doing a reflection video on Nursing 641 Primary Health Care of the Children in the Family Practicum. Today is October the 6th, 2019. In this video, I'll be addressing four main items. The first is to describe your past experience working with the pediatric population. In all my years of experience as a nurse, I have not had an opportunity to work with the pediatric population. My only experience with the pediatric population has been from babysitting my nieces and nephews and from my own three wonderful children. With that experience, I have always considered the pediatric population to be a very delicate stage in the human development, especially the infancy and toddler stage when they cannot verbally communicate their needs except through crying. This clinical rotation makes it my first known experience working with the pediatric population outside of my family and friends. This far, it has been a humble experience getting to interact with this population in a different capacity as a student family nurse practitioner, where I have been able to collaborate with a provider in diagnosing and treating this population group. The next question is, do you have any plans to provide pediatric care as a nurse practitioner? The answer is yes. As a family nurse practitioner in the making, I am being trained to take care of all ages across the lifespan. With that, I will include infancy, toddlers, school age, adolescents, adults, and the geriatric population. So I look forward to providing care to the pediatric population. Next, it says to discuss any concerns you have regarding this clinical. I would say my biggest concern with this population group would be how to effectively diagnose these toddlers and infants, because their primary communication is through crying. So my challenge would be to use all other techniques and clues to diagnose and treat this population group. All my experience has been mostly with the adult population and that can verbally communicate their needs and wants. So this group makes it even more challenging because they do communicate mostly by crying, since they cannot verbally communicate their needs. And the final question says, identify personal and academic professional goals for the clinical. I would say my first goal for the clinical would be that I can apply what I learned from my lectures and reading into the practical. I want to be able to correlate lectures and clinical. My second would be to be able to master the different prescription dosages among the different age groups and being able to prescribe efficiently to minimize any room for error. And lastly, be efficient in my assessment and diagnosis of disease condition in this population group. I look forward to attaining my goals and gaining more confidence in my ability to provide care in the pediatric group. Thank you very much. God bless.